This video will demonstrate manual muscle testing of the posterior deltoid muscle. The posterior deltoid originates on the scapular spine and inserts on the deltoid tuberosity of the humerus, which is innervated by the axillary nerve. Testing of the posterior deltoid is performed through shoulder horizontal abduction and begins with the patient prone, shoulder abducted to 90 degrees, forearm off of the table's edge, and elbow flexed. The patient horizontally abducts their shoulder against the clinician's downward resistance, which is applied just above the elbow. Push your elbow towards the ceiling. Hold it. Don't let me push it down. And relax. For grades 2 and below, shoulder horizontal abduction is assessed with the patient seated. Therapist supports the forearm. Palpation of the posterior deltoid confirms muscular contribution to the motion. Move your elbow backwards and relax. Here is an alternate test for grades 2, 1, and 0. The patient is in a short sitting position with arms supported on the table in 90 degrees of abduction and elbow partially flexed. The therapist should stand behind the patient, one hand placed over the superior aspect of the shoulder and the other over the scapula. The therapist will be palpating the posterior deltoid below and lateral to the spine of the scapula and on the posterior aspect of the proximal arm adjacent to the axilla. The patient will try to move their arm across the table in horizontal abduction. Move your arm backwards and relax.
This video will demonstrate manual muscle testing of the pectoralis major. The pectoralis major is comprised of two heads, sternal and clavicular, which originate on the clavicle and sternum and ribs 2 through 7, and inserts on the lateral lip of the humerus, and is innervated by the medial and lateral pectoral nerve. The clavicular and sternal heads of the pectoralis major are the prime contributors to shoulder horizontal adduction. Muscles can be tested together or separately. All gravity-resisted tests begin with patient in supine. When simultaneously testing both heads of the pectoralis major, the patient's shoulder is abducted to 90 degrees and the elbow is flexed to 90. The patient horizontally adducts the shoulder through available range. If tolerated, the clinician provides resistance just proximal to the wrist opposite the direction of motion, while the other hand palpates the pectoralis major just medial to the shoulder joint. Move your arm across your chest. You're going to hold it and don't let me pull it back. And relax. When assessing the clavicular head, the patient begins with the shoulder in 60 degrees of abduction and the elbow flexed. The patient then moves the arm diagonally up and across the body. The clinician applies resistance above the wrist in a downward and outward direction. The clavicular fibers of the pec major are palpated under the medial half of the clavicle. Move your arm up and in. Hold it. Don't let me pull it down. And relax. Assessment of sternal head function begins with the shoulder abducted about 120 degrees and the elbow flexed. The patient moves the arm diagonally, down and in towards the opposite hip. Resistance is given at the wrist in the opposite direction. The sternal fibers are palpated on the chest wall at the lower anterior border of the axilla. Move your arm down and in. Hold it. Don't let me pull it back. And relax. When the strength of the shoulder horizontal adductors is grade 2 or less, the patient's capacity can be evaluated either supine or seated. In supine, the starting position is again with the shoulder abducted and the elbow flexed at 90 degrees. The clinician supports the forearm by gently grasping the patient just proximal to the wrist. The initial angle of adduction and angle of pull will influence which portions of the pectoralis major are activated. Palpation will confirm the muscle's contribution. Try to move your arm across your chest and relax. For grades 2 and below, shoulder horizontal adduction can also be assessed with the patient seated and their test arm supported on the table. The arm is placed in 90 degrees of abduction with the elbow slightly flexed. The patient attempts to horizontally adduct the shoulder while the clinician palpates the pectoralis major to confirm contraction. Move your arm forward. And relax.